Hello everybody, I am Dr. Rachna Dubey and today I will be talking about high risk pregnancy. High risk pregnancy, as the name suggests, when a pregnancy is at a risk of causing adverse effects to a pregnant woman or to her baby, then we call it a high risk pregnancy. So basically, if you are an elderly primey, that is if you become mother for the first time after 30 years or even after that, then they are high risk factors. Short statured primey, that is if you become mother and your height is less than 140 centimeters or even below that. Malpresentations like breech presentation and transverse lie. What is the normal presentation of the baby in the uterus is a vertex presentation whereby the head is down and the rest of the body is up. So, if there is a variation in this, that is if it is a breech presentation where the head is up and the body is down, or it was a transverse lie, that is baby is lying transversely in the uterus, or it is an oblique lie, then we say it is a malpresentation. Antepartum hemorrhage is basically if your placenta is attached to the lower uterine segment rather than being attached to the normal fundus of the uterus, then it may cause bleeding in the pregnancy. Or if you are having abruptio placenta, if you have hurt yourself or fallen in pregnancy and because of which you are having bleeding, then this is a high risk pregnancy. If you are having threatened abortion, that the doctor has prescribed you certain medication, has told that you have had a threatened abortion whereby there were chances that your baby aborts, or 2 or more previous miscarriages, or if you have a previous induced abortion also, then these cases run a risk of further abortion or preterm delivery in the present pregnancy. If you have a preeclampsia, what is preeclampsia? Basically when your BP is more than 140/90, you are having proteins in your urine and you are having edema, then this is called preeclampsia. So, if you are having preeclampsia or eclampsia, eclampsia is when this condition is associated with fits and convulsions, then we call eclampsia. Anemia is also a very important factor and is a high risk pregnancy. If you are having a hemoglobin of less than 7 gram, then probably you are at a risk and you must improve your hemoglobin and take the tablets as prescribed by your doctor. Twin pregnancy or multiple pregnancy is also a high risk factor. Hydramnios, when we say the amniotic fluid in which your baby is living, this fluid increases than the normal values. So, if you are having polyhydramnios, then again it is a risk factor. Previous stillbirth or intrauterine death, or when your doctor has told that in the previous pregnancy you had a manual removal of placenta, these are risk factors in the present pregnancy. Elderly, grand multiparous women, means when your age is more than 30-35 years and you are delivering your third baby or maybe your fourth, fifth baby, then these are risk factors. If your pregnancy is prolonged, that is whatever date your doctor has given and you have crossed that date more than 14 days, suppose your expected date is 1st of January and you have already crossed 14th January, then this is a high risk pregnancy and you must immediately consult your doctor for intervention. If you have got a history of previous cesarean section or an instrumental delivery, then your present pregnancy is definitely a high risk pregnancy. If your pregnancy is associated with general diseases like heart diseases, kidney problems, diabetes, tuberculosis, liver diseases, or you have had thyroid dysfunction or abnormal thyroid values during pregnancy, if you have got psychiatric illnesses, epilepsy, viral hepatitis, or you are a carrier of hepatitis B, then your pregnancy is high risk. Certain infections in pregnancy like malaria and HIV infection during pregnancy is also high risk. If you are an Rh negative woman and you give birth to an Rh positive baby, then in the second pregnancy also you must get your Rh titers. This is very important because then there are certain complications which can occur to your baby and you must get your titers measured and tell your doctor that you are an Rh negative person and you have delivered a previous Rh positive baby. So, she will take care and this is also a high risk pregnancy. So, these are few risk factors which if you keep in mind these risk factors of pregnancy or high risk pregnancies, then it becomes very easy for you to tell your doctor and take appropriate measures during pregnancy. Thank you.